Okay, so this is atopic dermatitis, burden of illness, quality of life, and associated complications. So, atopic dermatitis is a chronically relapsing skin condition. It presents a broad range of disease severity from mild, which can be treated with over the counter products, to severe, which requires more complex treatment. It is important for clinicians to understand the burden of this condition on the patient and family. This article reviews the burden with respect to disease prevalence, financial costs, and impact on quality of life. Oh, and risk for complications. So it looks at all of these levels. So, prevalence, persistence, and population burden, right? Um, so the onset of this disease is typically early childhood, but it can occur at any age. Even though adults still continue to have eczema symptoms, they believe that the reason that these adults um, like see their providers less frequently was because of the common perception that atopic dermatitis creates. So basically, it is very clear that atopic dermatitis persists and is burdensome throughout a patient's lifetime. So the combination of high prevalence, usual onset in childhood, significant healthcare healthcare costs, and impact on quality of life all combine to make atopic dermatitis one of the most burdensome conditions in the U.S. and worldwide. So, and asthma is associated with this disease, and like it usually comes with it, and this adds on to the burden. So, AD, or yeah, atopic dermatitis, is associated with direct medical costs. For example, in the U.S., people with eczema tend to use healthcare resources more than those who don't have eczema, obviously. So the burden on their individuals and families now. Atopic dermatitis can be a very time-consuming condition, with some patients and families spending an hour or more each day doing activities related to this disease. And so the majority of patients have an itch on a daily basis, and this is associated with their mental distress, and it could also affect their sleep disturbance. So here's medical complications. Patients with atopic dermatitis are at risk for superinfection of their lesions with the patches on their skin they get from scratching, and for an eczema type of herp herpes. There's like your atopic dermatitis can get infected with a herpes virus. So it is estimated that 2/3 and 1/2 of atopic dermatitis patients will develop allergic rhinitis and asthma too. And atopic dermatitis is linked with attention deficit disorder, depression, and anxiety. So all these things. So basically, this article tells clinicians to show empathy for the patients and families and understand that AD can be stressful and have a major impact on a patient's life. And so they must consider the psychological factors coming into play and the financial costs. Clinicians should assess the patient burden during childhood encounters by not only by only assessing physical signs of the disease. So patient and family education on atopic dermatitis is crucial, um, like by like because if you're explaining to them that there's no cure, and explaining its persistence, then this creates an understanding with them, and it helps them cope a little bit more. And so improved management of atopic dermatitis by healthcare professionals help lift the burden on patients and families.